That makes sense. That's what we asked you. You want to put the right thing.
Yes. 1, 2, 3.
That's what I thought.
So they're not going to be drawn out of
I didn't want to say it was the file. I didn't want to say it was
Right.
some
So
decision.
those are the ones we're going today.
Those are pre-mix or it's not pre-mix, pre-made. Well, that makes sense.
No titration scenes.
Right, yeah, no spinning and Bunsen burners.
Right.
No, needle drive,
Looks like they got it.
it's coordinated up into the light. Well, you should be fit back.
All those Hollywood.
Say that it's before it's like medical sprinkles or something. But this one is.
But this one is very technical, yeah.
Thank you.
It works.
Yeah, I think so. And that's probably what would happen when they go.
Yeah. I'll.
Good job.
I like this arm where
One thing they said they were doing about over there here. I agree, but I was like, it's my social
you stood out.
Now, graduated 07.
Gives people some creep back. Looking at that right on that.
When you graduated? A year after. Graduated 87? Oh, wow. Wow. You like my uncle. You like the whole head. I mean, it's good thing. It's a good thing. Not bad. Anybody. I was a bachelor of arts. I was in the arts program.
Did you guys know John Decker? He's from Reuters. Yeah, he's the teacher.
I was an art student in Debbie Island. That's the only reason why I was practicing art. Debbie Island was like a professor at Howard, and I was trying to sneak her class.
Yeah.
They didn't let me. I couldn't get that override to switch over. I was going to be popular at Howard. I really didn't care about college. That's like
Just get working. Jump in and just.
Howard was like now it's like stupid.
You kidding me? Maybe that should come and get me this work. If you miss something, you gotta come back. What's Jesus Christ?
No, I don't care how old you are. Being all day on this board, it ain't kind of don't feel good.
Is the mic on? Good morning. My name is Tony Blue. I am the PR director for Howard University Hospital. I want to welcome everyone today to our COVID-19 vaccine media event. Today is a historic day for Howard University, the city, our community, in that we are about to distribute the first of what is hopefully many employees at the hospital getting the Pfizer COVID-19 vaccine. Excuse me. Today, I will ask CEO Anita L.A. Jenkins to come up to say a few words, and then we'll ask Dr. Hugh Mighty also to come up to say a few words to talk about the clinical aspects and also why this is such an important event for our hospital and the history of the city. Ms. Jenkins, can you please come to the podium?
Thank you, everyone, and thank you for joining us at Howard University Hospital. As Tony said, this is an historic occasion. We have the opportunity to fight COVID, a losing battle in which it has taken millions of lives. So I'm so glad to be here this morning. We will take the vaccine not to jump in line, but to show people and to help people understand this is a safe weapon against the scourge of COVID that has just been taking lives day after day. It is my pleasure to be a part of this display because we want to help people understand. I know that there are so many people that are worried about the vaccine, who mistrust it. People of color mistrust what might be coming down because it's research, or because it's unknown, or because it was rushed. So I felt it very important for me to say, I will take this vaccine. It is the weapon that will work. So I'm so excited to be here today and a little nervous, but I'll put my arm out today to fight COVID. Thank you very much. Dr. Mighty.
Good morning, everyone. And again, I'll echo Ms. Jenkins' remarks in that this is most historical and very important that we do this. As of today, one in every 1,000 Americans have died for COVID. 300,000 Americans in a country of 300 million. It's very important that we begin to fight back. And those who have died have disproportionately been among people of color. So I think it's vitally important that we do this, and until we get to having enough people who do this, we're not going to be able to really stamp this out. The one thing I'll say is that you can't get COVID, you cannot get COVID by taking this vaccine. And it is a big, powerful tool that we have for fighting what's ailing us right now in this country. So I, too, will step up and do my part, and hopefully everybody else will, too. Thank you.
So Frank is a member of our employee health team. He will administer the first shot to CEO Jenkins.
Are we doing here?
Yes, sir.
I have my COVID arms. This is not okay.
Which arms are you use? The most.
Which arm would you prefer?
Take your time.
The first shot.
one to the right. Why? Because I'm left-handed. That's why.
Alright, don't be showing me up there.
I'm not going to leave the whole bag over here.
No, you just take your time digging it up. Okay?
Yeah, this is right there.
Yes, you had somebody else take care of me this year. That was just abandoned me.
No, I didn't.
You abandoned me, yeah, you did. Effective, sir.
Huh?
Effective, sir. There you go. Thank you, sir.
Thank you.
Thank you.
Well, you got a lot.
Go for it. Alright. We'll be able to use my office.
One of our very important things to note is that everyone matters. And so our environmental services team, they are frontline, they are everywhere, and it is so important. And I want to thank Mr. Dunlap, our environmental services team leader, and one of our other environmental services. They will be some of the first to get this vaccine. So I just want to thank you so much, because he too is an example to let people know this is safe and this is part of the fight.
Bio out before you inject, please. I'm sorry.
Okay. All those who got the shot today, there is a card I need you to fill out over here.
Okay.
Your 21-day card.
Okay.
Sign
Thank you so much.
And you sign it.
Oh, yeah, we have one.
Yeah, can you just kind of pause a little bit longer? So,
There you go. That was a good idea.
And then we'll
Sorry to kind of critique you, you know.
You want me to hang it? I mean, we get shafts when we do it. It's over with,
I know, we do protocol.
Hold right there. Yep, hold, no, don't move.
I'm gonna pretend like, you ready? You good? Motion?
Oh, man, that's perfect.
Good?
Yep. Okay. Wake up.
Yeah. Your return date is the 5th of January, the second shot.
No problem. I'm patient.
My patient, huh?
Pardon me?
We got 10 people?
I think so. Go regular speed on this.
Oh, regular speed? Which arm do you use? Right here, that one?
Yep.
Regular speed? Sorry, I was in the way.
Thank you. Yep. Thank you, guys.
Our nurses, of course, and our chief nursing officer, Dr. Ilya. Good morning. Good morning.
I'm gonna do yours so they can see, because I did it at, so they can see.
So this concludes the vaccination portion of the event. Ms. Jenkins and some of our esteemed staff members will fill your questions.
Did you get Dr. Pudar?
Yes.
Reuters television, we did a story recently about reticence in the African American community to take the vaccine.
Sure.
What are your plans for that?
So as we know, there is healthcare disparities, whether it's access or whether it's treatment, that seems to resound with the African American community. Also, of course, the historical perspective of everything from the Tuskegee experiments to experiments on women in the Black community. Of course, there are reasons, and many reasons, for Black Americans to be concerned about this virus and its speed and its efficacy. However, this is a worldwide epidemic. This is a worldwide pandemic, rather. And the world needs a solution. So it's a world vaccine. And I honestly believe that it is not targeted in any one group or any one area. In fact, it will help all of those areas and all of those groups. I have not sold out just because I believe in science. We are seeing people die every day in our hospitals. We watch them suffer. We have seen families and employees experience such death with COVID. So I am excited and hopeful that this is a successful vaccine. Yes?
Tree Walters from WHUT. I know that we reached 300,000
Yes.
in deaths, and we needed a vaccination, like really, really bad. But what are the concerns of the side effects of this vaccine?
Sure. So far, and my team can come and join us, so far the vaccines are only showing maybe a 24, 36-hour response to the first one and to the second one. We need 2 vaccines. I'll get a sore spot. I might have a temperature, but I'm going to take a Tylenol, and I'm going to relax, and I believe that I will be 50% protected because I got this vaccine today, and 95% protected at that second dose.
What have been some of the logistical challenges with coordinating a second visit for everybody that gets the shot? How are you going to coordinate that?
So we got the vaccines yesterday, and we only got the first batch of vaccines. So they're coming in waves, and so we are making sure our officials want us to make sure that we give all that we got this time for that first. We want to at least get 50% protection, right, for the vaccines that we have now. And so as we look at how we're giving our first batch and how we're giving our follow-up batch, we're paying attention because we are taking good records of who took the vaccine. And not only are they responsible, but we will be responsible for that 21-day visit. We are adding some personnel to make sure that we've got the helping hands to keep track of those logistics. It's worth it. It's a lot to take on, but we're proud to be a part of this fight, and I'm excited to be a part of it.
Is there any indication or certificate or whatever that someone who gets the vaccine can then present? Is that how it works?
So we logged our names and numbers and our information like every vaccine that's given in healthcare environments. And then we just have a card that we just filled out, and so they're following up. So they know who got it, and they know when we will follow up. So we've already got our paperwork lined up to do that. And if someone forgets it's 21 days later, we will absolutely reach out to those team members. Any other questions?
Yeah, that 21 day, is that for the second dose?
Yes, that's for the second dose. Mm-hmm. Any other thoughts or questions?
How long is the immunity or protection from this expected to last?
We don't know yet. So that's something that our scientists don't quite know yet. It might be like the flu vaccine and you have to get it every year. We don't know.
The person assembling this story may not be in the room. Could you spell your name?
Oh, absolutely. Anita, A-N-I-T-A. My middle initials are L and A. I have 2 middle initials. And Jenkins, Jenkins, CEO of the hospital.
I do have one more question.
Yes, sir.
The quantity of the vaccinations that's been given to Howard and so many other places, is the quantity going to be enough for the people and for the second dose?
Absolutely. But we're getting them in pieces like everyone else, and so we are stretching out. We want everybody, and we have been recommended, we will all get that first dose. That's most important. So we're going to get that first dose, and as those second waves come in, we'll track and get that follow-up dose. It's a lot of logistics, but we're happy to be a part of that. My goodness, I'd rather deal with those logistics than to keep dealing with our sick and dying COVID patients. Yes, ma'am.
The fear is still there,
sure is.
Community. You see the memes on social media, the jokes and so forth. Speak to that for
Absolutely.
in getting the African American community to buy in.
That's why I put my arm out first. I know we have trust issues with healthcare, right? We have, and we have for years and years. Yet we understand that this is a disease, this COVID, we are losing, and African Americans are losing even more. This is a virus that doesn't care about what color you are or whether you mistrust it. But the vaccine doesn't care either. The vaccine helps all of those, whether you mistrust it or whether you trust it. And so what we are trying to do is educate each and every one of us. I've had meetings with a community group, we have a patient advocacy group, with our staff, with our leaders, to help them understand the facts. And so the facts are really what help people get through some of this mistrust. And then some of it, we understand that people will just have to wait and see. I had a friend say to me, well, I'll see what happens to you. And then I'm okay with that. I got this vaccine. They can watch me tonight, tomorrow, next week, 6 weeks from now, 6 months from now. But please get that vaccine eventually, because it's the only fight, it's the only positive weapon that we really have against COVID. We treat it, but we don't have a real weapon like a vaccine.
Final question.
Hi, Lola.
Were you hesitant at all to get the vaccine, and if so, was there a turning point for you?
Absolutely not. It is such a blessing to work here at Howard University Hospital. With the university and the hospital, there was so much information just readily available. Even one of our physicians, Dr. Fulham, he sent some new information just this morning. Look how this one explains how the vaccine works and how it affects your body and how it treats. So we have the access to such information that the science paid out for me. And so I was definitely willing to go ahead and take this shot without hesitancy. Doing it on camera was a little much, but but definitely without hesitancy. And then a lot of faith. I do believe that that we've got a lot going on for us here. So I was happy to take it. And I want to take it for my family, for my friends, for my people, for my village, for my aunties who I haven't seen, and my kids, and my grandkids who I haven't seen. So I want to see them, and I want them to live great long lives. So we're going to fight this way, and I'm fighting first. Thank you. Oh, I can't believe it.
Thank you. This concludes the Howard University Hospital COVID-19 vaccine media event. If you have any further questions, you can you can email me.